The fourth station is the strength assessment station. This station is easiest to learn by following along with the member packet. The first sections of this station consist of upper body, lower body, and core, and are rated as good, fair, or poor. For the upper body strength assessment, you'll ask the patient to complete as many push-ups as they can. If they are unable to complete one push-up with correct form, then they receive a grade of poor. If they are able to complete one push-up with flat back and knees off of the floor, they receive a grade of fair. And if they are able to complete 10 push-ups with flat back and knees off of the floor, then they get a grade of good. Mark the number of push-ups and grade on the member's form. Next, assess the strength of the lower body. Have the patient complete as many bodyweight squats as they can. If they are unable to complete one full squat by allowing their thighs to reach parallel with the ground, or if they have to use their arms for assistance then they get a grade of poor. If they are able to complete at least one squat with arms held straight out in front of them and their thighs reach parallel, then they get a grade of fair. And if they are able to complete 10 squats with their arms held out straight and their thighs parallel to the ground, then they get a grade of good. Next, to assess the core, we will use the following pictures because we were unable to film this portion from a YMCA member. To specifically test the upper abdominals, ask the patient to complete as many sit-ups as they can. If they cannot complete 10 sit-ups, or they have to use their arms to reach forward for momentum, then they receive a grade of poor. If they are able to complete 10 sit-ups with their arms across their chest, then they receive a grade of fair. And if they are able to complete 10 or more sit-ups with their hands at their temples, then they receive a grade of good. Next, to assess the lower abdominals, have the member lie on their back with their legs at 90 degrees. Ask the member to slowly lower their legs to 2 inches off the floor, while maintaining control of their core. If they are unable to maintain control as they lower, then they receive a grade of poor. If they are able to maintain control while lowering their legs, but unable to hold for 3 seconds at the bottom, then they receive a grade of fair. If they are able to maintain control and hold for 3 seconds, then they receive a grade of good. For all of the remaining tests, excluding the calf raise test, pressure should be slowly increased by the staff member for a count of 3 before releasing. A normal rating is given if the subject can hold against resistance without compensation. A rating of weak is given if the member cannot hold against resistance for 3 seconds. For testing the rotator cuff, the member will be sitting in a chair or on a secure table with both elbows at side and bent to 90 degrees. The staff member will then place both hands at the member's wrist and push inward. For testing the shoulder or mid-deltoid, the member will be sitting in the chair or on a secure table with the arms raised at sides to a 90-degree angle. The staff member will then place their hands at the top of the member's arms above the elbow joint and apply pressure straight down. For testing the biceps, the member will be sitting in a chair or on a secure table with their elbows bent to a 90-degree angle and their palms facing upwards. The staff member will then place both hands at the wrist and pressure is applied straight down. To test the triceps, the member will be in the same position as when testing the biceps. The only difference is the staff member will apply pressure at the back of the wrist towards the patient. To test the wrist extensors, the member's elbows will be bent to 90-degree angles with their wrists extended back. The staff member will then place their hands over the member's knuckles and the force is applied down and back towards the staff member. To test grip strength, you'll ask the member to grasp both of your fingers and squeeze hard. You'll note the difference between both hands. To test hip flexion, you'll ask the member to raise their knee towards their chest. You will then apply force straight down at the top of their knee. To test hip extension, have the member lying on their stomach and ask them to kick their foot straight into the air, making sure to keep their foot parallel with the ground. Apply force straight down at the bend of the knee. To test hip abductors, have the member in a seated position with their knees pushed out. Apply force at the outside of their knees directly inward. To test knee extension, have the member seated with their knee extended but not fully to avoid stressing the knee. The staff member will then place one hand on top of the knee and the other at the shin, applying a force straight back. To test ankle dorsiflexion, the member will be seated with their ankle bent up towards their shin. The staff member will then place their hand at mid-foot and pressure is applied straight down. Next, you will test ankle plantar flexion. You will ask the member to complete as many calf raises as they can. If they can complete 15 calf raises, they get a grade of normal. If they are unable to complete 15 calf raises, then they get a grade of weak.